Federal Health Minister Greg Hunt also spoke a short time ago about the Commonwealth's assistance for Victoria.
In one state, in particular in one city, in Victoria and in Melbourne respectively, the challenge remains great. So today I want to outline some of the actions that the Commonwealth is and will be taking to support Victoria and Melbourne at this moment of challenge. Firstly, with regards to the tracing that I mentioned, this remains a fundamental national priority to ensure that each case every day is traced. As part of that, the Australian Government has made the ADF, our extraordinary military women and men, available across the states and territories to assist in whatever way, shape or form will meet the needs of that particular jurisdiction. The advice I have from the Defence Minister, only briefly before joining you, is that there are now over 2,700 ADF members who are part of Operation COVID Assist. In Victoria, there are already 1,212 ADF members on the ground. They are to be joined this week by an additional 272, taking the expected number to about 1,484 Australian Defence Force women and men. And they are assisting. In particular, they have helped with border control, with isolation, with checkpoint work, but perhaps most importantly, in providing support, assistance and rigour in the contact tracing program. That is being done at the request of Victoria after the Commonwealth's offer, and it is being done to make sure that the standard of each case every day is met. There can be no compromise on that standard. So our support is open-ended, as long as it takes as much as is needed, confirmed again by the Prime Minister. I want to thank all of our ADF men and women for their work, their commitment, many of them bringing themselves away from their families and to Victoria, being on the front line, potential exposure to the disease, but their infection control training, their disciplines are of the highest order. They believe in Australia and they believe in the Australian ideal. Beyond the ADF, in particular, we have partnered with Victoria to protect our elderly. The partnership is with the public sector, the private sector, the Commonwealth, the state and the families. In particular, we know that there have been residents in 16 aged care facilities who have been infected and clients in 3 home care services that have been infected. All up, 103 residents and 120 staff. When you include those facilities that have staff, that would make 49 residential care facilities and 6 home care services. In order to protect these residents and the staff, most of whom have contracted the virus within the community following, of course, the catastrophic breach of hotel quarantine, which has seen a city of 5 million in lockdown. As a consequence, what we're doing is a new series of actions with Victoria. An additional 1 million masks for regional Victorian aged care facilities. An additional 1 million masks for disability workers across Victoria. We are putting in place additional staff work support so as, in partnership with the aged care sector in Victoria, there will be the capacity for additional funds for additional periods of work for individuals to remain within a single aged care facility. That is the goal which we have agreed upon with the support of the workforce and the support of Victoria and the aged care facilities. In terms of testing, 5 mobile testing teams have been stood up by the Commonwealth to ensure that staff and residents are tested in a timely fashion, that this is an absolutely critical step forward. Tracing of cases of those coming in to aged care facilities in Victoria, with our support and consent, has announced additional but difficult and challenging restrictions on visitation, which, whilst we would never want, we recognise they are necessary. And then in terms of infection control training, we are working with Victoria to build on the number of staff who are able to apply the highest levels of infection control training. Across the state, Victorian staff have been extraordinary. This then brings me to our last action, and that's the decision of the Victorian Government in relation to the mandatory wearing of masks across the Melbourne area and Mitchell Shire. I've been in contact with the Prime Minister, the Chief Medical Officer, Professor Paul Kelly, and the Secretary of the Health Department, Professor Brendan Murphy. Together, we fully and completely support this difficult decision for the mandatory wearing of masks. It is a function of the level of community transmission in the Melbourne region and surrounding areas. It is necessary, and we are sorry that it has reached this point for all those who are affected. But this is about saving lives and protecting lives.